patients and staff safe while continuing care? It's time to connect. Stop by the Relation booth and watch our presentations here at the conference.
Eagle, go. Decom, 15 seconds. 3, 2,
Audi e-tron, the next frontier of electric.
Hello everyone, my name is Craig Weberg and I'm Senior Editor at MGMA. Welcome to today's 10 ways to connect with patients using text messaging during COVID session. We have a few reminders before we begin. You can claim ACMPE, ACHE, CME, and CEU credit, and if you view the live session, AAPC and CNE credit. Claim continuing education credits starting next week using the MGMA CEU portal. The code for AAPC credit will be emailed to you. Submit your questions, resources, and comments using the chat area. Slides and resources can be found in the lower left section of the previous session page. The education for this session will now begin. In today's session, Leah Chatham, Director of Content at Solution Reach, will explore how organizations of all sizes are using text in new and innovative ways. Leah, I know you got a lot of great information to share, so I'll turn it over to you.
All right. Hi, everybody. Thanks for joining me today. I'm so excited to be here. We're talking about 10 ways to connect with patients using text messaging during COVID. Although I would say this is during COVID and probably ongoing for the long term. We're certainly seeing that text messaging is one of the solutions that's getting a lot of use right now, and patients really like it, and I think we're going to continue to see that. My name is Leah Chatham, and I'm the Director of Content at SR Health by Solution Reach. You'll see I have my little note here. I don't have any conflicts of interest. We're going to quickly go through our learning objectives, and then we'll jump right in because we've got a short presentation today, and I want to make sure we can cover everything. So we are going to be talking about how to use text messaging to address some of health right now. We're also seeing people using texting for sort of doing this park and text waiting room. So we'll talk a little bit about some of the best practices around how to do that. And then talk about how you can use text messaging to really manage that mix of in-person and virtual visits. Again, something we're seeing quite a bit more of during COVID, but I think the data is showing us that patients are already feeling like this is going to be the way they want their healthcare to be moving forward. So we'll chat about some of those things. We don't really have polling in today's system, but I did just want to ask, and if you can throw your answers into the question bar or the chat. I'd love to know how many of you are using text today, and if this is more your personal feeling, did you use text messaging today, and did you use it for something other than like a personal communication with someone? Did you get a message from, well, I just moved into a new house, so I'm getting a lot of messages from Wayfair and Overstock, but maybe you got a message from a healthcare provider, or you got a message reminding you about a haircut, so throw it in there and let us know. If you've been texting today, if you have used text today for things other than your own, personal chatting back and forth with friends and family. I think when you really stop to think about it, we all use text messaging more and more. I used to say when I was presenting about text messaging, oh, if you were at Starbucks today, did you look around and see, that people were using text messaging? It's something that really has become pretty ubiquitous. We know that the majority of smartphone users use text. It's the most used application on smartphones. And the majority of people have smartphones. So 81% of people now have a smartphone. 97% of them use it for text messaging. 76% of people think text messaging is more convenient than phone calls. Text messages tend to be read within 15 minutes. This is a pretty substantial difference from what we see in the data around phone calls. So today, about 90% of people say that they don't necessarily answer their phone. They will let it go to voicemail, especially if it's if it's a number they don't know. And nearly 20% of people say they don't even check their voicemail anymore. They just wipe it. So it's text is certainly more likely to be seen, more likely to be read than phone messages. We did a recent research study that showed that interest in phone calls in the healthcare space particularly has dropped by nearly 15% just since COVID began. So people really are making this switch to more digital solutions. And over 70% of people have said they want to be able to text their doctor or their provider's office. Nearly 80% say they want to be able to get texts. And that's both sort of real-time two-way text and automated text. And that brings us to kind of this next piece. So really, we can look at text in two different ways. We can look at it in the automated texts, which I think more people use, right? Automated appointment reminders, pre-visit instructions, intake, surveys. People are using it quite a bit now to set up automated messages asking people to sign up for the portal, because a lot of larger organizations are using their portal to kind of facilitate telehealth. That's become kind of a critical thing. Then we're also seeing, the use of real-time text messaging, which is more answering people's questions, maybe reaching out ahead of visits and doing some pre-screening or verifying insurance, using it for park and text waiting, or to follow up with messages about, hey, can you call our billing office, or here's a link to pay your bill, as well as this kind of follow-up we're seeing now that we didn't really see much of before, which is more around social determinants. So, our title said 10 ways to use text. This is 12 ways to use text. I could have probably put in a list here of 20 ways to be able to use text. We're going to touch more in more detail on the ones here that are highlighted. But I think you'll also see that we kind of hit on several of the others at the same time. So kind of talking about the real-time text. So this is, for the patient, what feels like texting with friends or family. They've got your number in their phone. They can text back and forth with you. You can have a widget, say, on your website or social media or online listings that lets them click on that from their phone and text with you. And they can use, emojis or pictures as well as text. It just feels like real texting. So one of the big ways we see people using that real-time text really is just patients texting it with very common questions: directions, hours, same-day appointments, do you take my insurance? And then things from in the reverse from the office, like, hey, we didn't get a confirmation back from you on your automated reminder. We're just checking in to make sure you're going to be here. Or we're sending a text to all patients, just doing a quick screening for COVID. Have you had any symptoms? Do you have any questions about our protocols or safety protocols? You can see this image at the bottom is another example of kind of a contact us now or contact us today that can be used with a texting widget. It's very easy. One of the nice things is that today you can set up preset answers to a lot of common questions in text, sort of like you do with a chatbot on a website. And that saves a lot of time, right? You're cutting down on the number of phone calls. We often see people taking a little bit of time to, really document for a little while what their phone calls are. So maybe you spend 30 days tracking what are the most common things that come in through the phone. And what people often find is that a fair chunk of those are scheduling and sort of a set of 5 or 10 kind of common questions. Those two things really can be moved largely to other solutions, right? You can do online scheduling, which can also be linked to from almost anywhere. And you can automate responses to common questions through text or through your website. So it really helps to remove a lot of the burden on staff, especially at like now, where people are often calling with even more questions about protocols and COVID and what do we do and how do things work and what if I have symptoms, where do I go? There's just a lot of stuff you can kind of automate so that your staff aren't being totally overwhelmed. Another way to help reduce a lot of that is by doing a combination of reminders and pre-visit instructions that really helps people understand exactly what to do regardless of what type of visit they're having. So this is where we're now into more automated communications. They can be preference-based. So we find that a lot of people would prefer to have text messaging, but maybe they want email or voice, really giving patients the option. your reminders are much more likely to be seen and responded to so that you can get those confirmations if you're using patient preferences to deliver those reminders. Same thing with kind of the cadence of reminders. There's some data to suggest that actually the best cadence is kind of something around 3 weeks, 3 days, 3 hours. But you may want to test that and figure out what the best cadence is for your patients. Again, you can also give patients the option, right, to say, like, I just want one reminder 2 days ahead or something like that. And when we're doing telehealth, we want to take that into consideration and potentially have some kind of automated reminder that goes out just a little bit ahead of the visit that gives people those telehealth instructions. And this is where we get into the importance of the pre-visit instructions. If it's telehealth, they need those links and instructions on how they're going to participate. If it's in person and you're doing something like park and text waiting, they need the instructions for that, as well as those COVID screening instructions, right? If you're, to be able to say, hey, if you're having any of these symptoms, call our office first. And then on top of that, we've got our usual kind of pre-visit instructions like fasting or bring medications or whatever the case may be. Because our goal here obviously is to make sure patients are showing up for the right type of appointment in the right place at the right time, prepared. And for things like telehealth, you may also want to consider some of those key things that are important to a telehealth visit, like make sure you're in a quiet, private space, that you've got a device you can use. Some of these things may be repeated from other information you've given them and at the time of scheduling or in an earlier reminder. But this is a time where things are so much more complicated and there's so much more going on. You really want to make sure people know exactly what they're doing. And this is just an example of sort of signage or emails that you can use if you're doing park and text. Park and text is great for just trying to eliminate any kind of worries around using your own waiting room spaces. The idea here is really around both patient safety and staff safety and trying to minimize the use of where people are most likely to come into contact with one another. And by letting people just stay in their car, really you're kind of eliminating any issues around your waiting room or waiting area. So you can ask people to park and text, you can ask people to stand outside, you can mark off, 6 feet apart spacing outside of your office and have some signage that just says, don't come in. I've had some experiences lately with my own visits where there's been a sign on the door just saying this door is locked, just a reminder you need to text us or call us, and somebody will come, come figure out, what your next steps are. Sometimes they're going to follow up and have somebody come out and do a screening, or they're going to send you some paperwork or whatever the case may be. Just make sure people are aware. And text is really a great way to do that, because when you send an automated text, if you have the right kind of system, people can actually text you back, and that can transition into a real-time text conversation. So send the reminder, it says, please wait outside and text us from your car. And somebody writes back and says, well, how am I going to pay my bill, or how are you going to check my insurance, or how am I going to fill out my paperwork? And you can say, oh, before your visit, you're going to get digital paperwork to fill out, or somebody's going to come to your car, or whatever the case may be. And that kind of brings us to, I've mentioned pre-screening a couple of times here because text is so effective for that. You can do pre-screening in a few different ways using text. One is in your actual intake forms, right? So maybe the day before or the day of, the patient also gets a text message that says, here are your intake forms for your upcoming visit. Please complete these and to prepare, whatever the case may be. They do that on their phone or whatever other device they may have. And you include a pre-screening form in there. So it's, have you had any of these symptoms, or have you been in contact with anyone who's tested positive? You can also do it in your reminders, where you just say something like, if you're having any of these symptoms, please call our office. We may need to make a change to your visit, or where you're being seen, or who you're being seen by. You can also do it in real-time messages. So perhaps you've been asking people to just confirm their appointment and let you know that they're doing okay, they're not having any COVID symptoms, but you have a handful of patients who have not responded and have not confirmed their appointment. in the morning, you can send them just a real-time text message, you know, hi, Bob. We've sent you a couple of reminders about your appointment today, and we haven't heard back from you. We just wanted to check in and make sure that you're going to be here today, and also to confirm that you're not having any of these symptoms. So there's multiple ways through automated and real-time text messaging communications that you can do that pre-screening. And we all know, you know, not everyone is as responsive as other people. We have to sometimes try multiple channels to be able to get to people. As I mentioned earlier, one of the biggest sort of booms in text messaging that we have been seeing lately really is using text messaging to drive people to portal adoption. And this has really been driven by kind of telehealth and more remote, other kinds of remote telemedicine visits. So kind of those store and forward visits where maybe you're communicating securely behind the scenes in the portal about conditions or visits. We're seeing it being used by a number of our customers who are large pediatric practices, where they have to have a separate portal account for their adolescent patients between 13 and 18. And those adolescents are only responsive to text. So they're trying to get those 13 to 18-year-olds on the portal and actively using it to be able to do telehealth visits. We're seeing it a lot for behavioral health and mental health, you know, school programs that are facilitated by community health centers, where they're trying to make sure that these kids have access to the right tools and that they're all able to log in and able to do these, you know, maybe it's group behavioral health visits and things like that. There are just a lot of different reasons why right now, if you're wanting to keep people engaged, you're wanting to make sure that you can stay in contact, you know, and that is really another thing that we've seen quite a bit of lately in general around addressing these social determinants of health, as I mentioned earlier. So one of the big issues we're seeing with COVID is that patients, especially older patients and patients who do have a number of maybe social determinants, who have lack of transportation or lack of immediate family sort of support and care, are becoming more isolated because of COVID. I know in my own case, my mother-in-law had some health issues. She had a surgery. She had some complications. She's always been a very independent, active person who's taking care of herself. But suddenly we were faced with her mobility being reduced and COVID was starting up, and we ended up having to move her into a facility because that was the only way we could ensure she could get occupational and physical therapy and be able to ensure safe transport to and from her various visits. But at certain points, they cut back on her visits and didn't want her leaving the facility or going for treatments or going for some of her additional physical therapy. And I kept thinking, well, I'm glad at least she's in the facility because she's got some social interaction. If she had been at home and they had canceled all these visits, she would have been incredibly isolated. And that would have been, I think, a very bad thing. Normally, I wouldn't say that I would want my mother-in-law to be, you know, in a facility, but in this case, actually, I think it worked to our advantage because she's not as isolated. We have certainly seen some organizations using this to make sure that there's regular, consistent follow-up with patients who they feel may be at risk. So that could be someone who came into, you know, the ED or the urgent care and they didn't have a primary care provider, right? And sending out a message to say, hey, if you need some support, if you have questions, feel free to text us back at this number. Same with post-surgical follow-up, you know, being concerned that people may be less likely to be compliant or to do some of the follow-up they need because of their fear. MGMA had a study over the summer in their series of kind of COVID studies that suggested 87% of people who haven't gone to the doctor in the last 6 or 8 months, it's because they're afraid. They're afraid of getting sick. They're afraid of getting COVID. This is an opportunity to sort of stay in touch with people and make sure they're following up. And if they have questions or concerns, if they are feeling fearful, that you can provide them with some support. Same with, you know, high-risk patients in many specialties. There may be patients you already are aware are high risk because they don't have enough support They may need additional services. They're due for care that they have not scheduled, maybe because they're afraid, looking at whether or not those visits can be done through telehealth and trying to address that isolation. One of our customers sent us a note to share something with us that had happened. They have been using text messaging to follow up with patients coming into the ED and the urgent care. And they sent a message to this patient who'd come in, and his daughter replied saying, "Thank you. My dad really needs more help. My mom passed away. He hasn't seen a doctor. She used to handle all of that." They went on to have a text message communication with the daughter about how they could help. And she was so grateful that they had followed up in this way. So this is a great way to kind of check in with patients and make sure that people are not too isolated, that they're not, missing out on important health care that they need. It's just a different time. Although I will say that I think honestly, just because we haven't done this stuff before doesn't mean it can't be useful even when COVID is over. I think there's some great opportunities. We're learning as we go through COVID that there are many opportunities here for us to do things a little differently and to support patients in a better way, quite frankly. And I know that a lot of people are concerned about being compliant with text messaging, and I'm here to tell you it is easier than you think. So there are a couple of different kinds of messages, and it's important to understand which ones are healthcare messages and which ones are considered marketing messages. So healthcare messages are things like reminders. That can also be recall and follow-up care. It can be education or, more broadcast type reminders about things like flu shots or that kind of thing. Marketing messages are things that are actual marketing messages. So like we're having a discount on a certain kind of care or something like that. If you've got a med spa, or you also do, you've got specialties in your office that cover vision or things like that, where you might have actual marketing messages, or derm, where you're selling products or things like that. But it also includes billing. So you can't send billing reminders and things like that without consent. So the difference is, for marketing messages, you need written consent. For healthcare messages, you do not need consent. That's implied by the person being your patient. And as long as it falls into those exempt healthcare messages, you're totally fine to send text messages. The one place where you do need to get consent is if the patient wants to discuss protected health information. So it's really easy to do. So patients are not covered entities under HIPAA. They can send you anything they want. So patients can send you messages saying like, "Oh, I fell down and I hurt my arm and here's a picture." That's totally fine. For you to respond and discuss some kind of course of treatment with them or ask for more information, then you are getting into PHI as a covered entity. All you need to do is say, "Do we have your permission to discuss this over this channel," which is not secure. They just say, "Yes, I consent," and then you can continue that conversation. So it is actually pretty easy to be compliant with text messaging. And I think the main thing is just to understand what is considered a healthcare message, what is not, how to get consent if somebody wants to discuss PHI, and how to get written consent if you want to be able to use text messaging for other things that are considered marketing messages, including billing. And there are a couple workarounds for that. We have seen a lot of organizations send out text messages saying things like, "Hi, Bob, could you please call Martha at our billing office? She's got some questions for you. Here's the number." That is a workaround for the billing piece. You can't send something that says you owe us $25, click here to pay it, without the consent, but you can do more of a generic message. So there's some workarounds, but it's great to consider including some kind of written consent in your forms just to make it easy, and then just tracking that in your system. So important to remember, you can be compliant easily. Patients do really want text messaging as an option. It's something that they are eager to have. And it is a great way to stay connected with patients, both in an automated way and in a real-time way. And it really does open the door to being able to care for your patients sort of in a new way, in terms of looking out for those patients who may be at higher risk or who may need additional follow-up. So that brings us to the end of our presentation today. And I do just want to open the floor for questions, and I'm happy to answer any questions here or any follow-up questions afterwards. I'll put up my contact information. So if someone does have questions later, you're absolutely welcome to reach out to me, and we'll answer the questions that have come in live now.
All right, great presentation, Leah.
Thank you.
I know you've been answering some of these, so do you have any that you'd like to start with?
Yeah, so there's a couple of trends that I have definitely seen as we've been watching the questions come in and we've been answering them behind the scenes. One is about kind of the way texting works. A lot of people have been asking how many phones do we need, or how do we protect our physicians from getting text messages from patients, and what do we do after hours? So I think the first thing is just to clarify that usually if you're using some kind of patient text messaging solution, like software system, provided by a vendor, those solutions look like text messaging to the patient on their end. They're obviously using their phone. But for you on the provider side, you're managing that from an application on a computer, and you are able to manage who is responding to those text messages, who's responsible for kind of seeing them and tracking them and responding. And you're doing that on a desktop or a laptop or an iPad or whatever it is. So it's not necessarily just text messages going back and forth between patients and staff members or patients and providers. You're in control of who's responding. And the other piece is people are often concerned about, well, what do we do after hours, or if we're very busy? You can preset a lot of responses that are timed for that purpose. So you can have automated responses after hours to say, like what you would say in a voicemail response, right? If this is an emergency, please call 911, or if it's not an emergency, something that says, these are our hours, you can find more information on our website, and whatever it is that you feel you want to put into that messaging. So I hope that clarifies for everyone. You don't have to worry about buying a lot of cell phones or trying to protect your providers from getting a lot of text messages from patients. The other one is obviously, as I kind of wrapped up at the end, we were talking about compliance, and we were getting compliance questions all the way through the presentation. And so I think it's really important to make sure everyone understands it's actually very easy to be compliant with text messaging. And the federal government has come out repeatedly at events across the industry over the last 2.5 years or so, 2.5, 3 years, as well as in a number of publications trying to get that message across, that they would actually prefer to see healthcare providers using simpler solutions for text and email, really trying to remove barriers to patients being able to communicate with providers. And so really the important thing to understand is just that there are, from the automated side, there are exempt healthcare messages, like I mentioned, reminders or recall or lab test, information, those kinds of things. And then there are these marketing messages or billing messages. And so for healthcare messages, you don't need consent. For marketing messages, you need written consent. The best way to do that really is just to manage it as a part of your normal annual forms process. Where you do need to get consent is if you are allowing people to do that back and forth conversation with you, and someone wants to talk about PHI, you just need to say, this isn't a secure texting solution, or this isn't a secure email solution. I just need your consent to continue this conversation here. Generally, we see patients perfectly happy to give their consent and continue that conversation because it's what's convenient for them. If you do get someone who says, no, I don't want to do that, then you say, let's switch this to a phone call, a visit, the portal, whatever makes sense for you and for that patient. So it's, people are asking about, like, do you have language? It's very simple language as far as, hey, this isn't secure. I want to talk to you. If you want to keep this conversation going, just tell me, just say yes or say consent in your response. For those marketing messages, it's just adding a line or two to some of your standard forms that say, we'd like to be able to send you marketing messages and billing messages via text. Is that okay? It's not, I think we have a tendency to make things more complicated than they need to be.
I've got another question here from Whitney. When using a messaging platform, is the conversation documented in the chart?
Not usually. So usually there's a limit on how much integration there is between your text messaging platform and your EHR. So often the text messaging platform is integrated enough to show you who is text messaging and to even populate sometimes a little bit of additional information. But in terms of being able to actually have that saved directly into the EHR, most solutions don't do that. They do, some like ours do maintain that history forever. It doesn't go anywhere. And for people who want to move that into the EHR, it's pretty simple to do a copy paste.
Couple more, and then we're going to have to wrap up the session today.
Yeah.
Tom is asking, is there a resource where they can find documentation related to consent exemptions and situations where consent is needed? Is there any master list anywhere?
Yeah. So, in the same places where you find pretty much all other information about how to be compliant with HIPAA, wherever you currently get that information for yourself, you'll find there's information there about how to address PHI. For TCPA, which is the other legislation that regulates text, there are a lot of resources. We provide some education on our website, but you can also just look up TCPA regulations. There are some other things to be aware of that you'll find when you do that. There's some guidelines around having clear opt-outs around length of text messaging. We often get people saying, why are text messages restricted to 160 characters? We want to send more information to patients. That's actually a regulatory thing. So there are some other guidelines. We have a guide on our website. If you go to srhealth.com and go to our patient engagement HQ, there's a guide there called Become a Text and Email Compliance Guru. Has a ton more information that you might find helpful.
All right, a couple more. I think then we're going to need to go. Is this compatible with multiple languages?
Yeah, so I see her question there, and she says maybe that's dependent on vendor. It is dependent on vendor. So for the automated text messaging, I think we provide, 15 or 20 languages. It's a lot. It's quite a number of languages. Obviously, if you're using real-time text messaging, it's dependent on your staffing. So that depends on, do you have people who speak those languages? We mostly see people in areas where they want Spanish, and they maybe have Spanish-speaking staff members who respond to real-time text, and then they turn on the option for Spanish language automated messaging.
All right. Unfortunately, I've got to get to the next session, so I'm going to have to cut this off. But Leia's information is in her slides, which can be downloaded on that previous page. I encourage you to get a hold of her. Also, Solution Reach's booth is available in the Solution Center, so go visit her there. And thank you so much, everybody, for all of your great participation today, and thank you for that great education session, Leia.
Yeah, thanks for having me, Craig, and thanks everybody for coming. It was great to get a chance to talk to you.
All right, thanks so much. Bye-bye.
Bye.